Does HRT increase your breast cancer risk? Hormone replacement therapy is often used to help women manage symptoms during menopause, like hot flashes and night sweats. But many wonder if it affects breast cancer risk. The answer depends on the type of therapy, how long it is used, and personal health factors. There are two main types of HRT. Estrogen-only therapy is usually prescribed for women who have had their uterus removed. Studies show that estrogen-only HRT generally has a neutral or slightly lower impact on breast cancer risk compared to women who do not use HRT. This means it does not significantly increase the chance of developing breast cancer. The other common type is combined therapy, which includes both estrogen and progestin. This is typically prescribed for women with an intact uterus to prevent uterine cancer. Research indicates that combined estrogen-progestin HRT can increase breast cancer risk, especially if used for more than 2 years. Women on this therapy tend to have a higher incidence of breast cancer compared to those who never used hormone therapy. Statistics suggest that before age 55, the risk of breast cancer for women using combined HRT is about 4.5%, compared to 4.1% for women who do not use HRT and 3.6% for those on estrogen-only therapy. While these numbers seem small, they highlight a real increase in risk with longer use of combined therapy. For women who have survived breast cancer, using HRT can slightly raise the chance of cancer coming back. Studies show that in women with low-risk breast cancer, the risk of relapse might go from around 5% to about 7.2%. For women with moderate-risk cancer, the risk can increase from 14% to 20% over 7 years. Most of these relapses are local or new breast cancers, which are often treatable, but the risk of distant relapse is also slightly higher. Long-term use of combined HRT, especially beyond 10 years, is linked to a higher risk of breast cancer. That is why doctors recommend using the lowest effective dose for the shortest time needed. Estrogen-only therapy, if used without progestin, can increase the risk of endometrial cancer in women with a uterus, which is why it is usually combined with progestogen to reduce that risk. Because each woman's situation is unique, it is essential to discuss personal risk factors with a healthcare provider. Age, family history, personal health history, and whether a woman has had gynecological surgery all influence the decision. Regular breast cancer screening is also important for women on HRT to catch any issues early. In summary, combined estrogen-progestin HRT is associated with a higher risk of breast cancer, especially with longer use. Estrogen-only therapy appears to have a lower or neutral risk profile. Women should talk with their doctors about their individual risks and benefits to make informed choices about hormone therapy. Always seek personalized medical advice to ensure the best approach for your health.